The Vaccines for Children program marked its 30th anniversary last week. Joining us now to talk more about this is Dr. Desmar Walkes, the Austin Public Health Medical Director. Dr. Walkes, thanks so much for being with us.
Thank you for having me.
So, Dr. Walkes, I wanted to talk to you. How are you concerned? How much are you concerned, rather, right now about the vaccination rates in area schools, many of which are below 95%? What would you say is the overall risk that the outbreak of measles we're following in the Panhandle will spread to Central Texas?
Right now, we are concerned about those areas that have schools with vaccination rates that are low across our jurisdiction. We've been talking to area principals and superintendents and sharing information about the risk that's associated with that. We've developed a calculator that they can use to plug in what their vaccine coverage rate is for their particular school so that they can understand risk. The CDC has developed a model that shows that if vaccine coverage drops below 90%, that there's a 51% increased risk of having an outbreak in that school. And so we are doing a lot to get that message out so that we can increase compliance.
And to add a little historical context here, the city's vaccine program, like we talked about, marked a milestone last week 30 years ago, but also 30 years ago, the country was dealing with another measles outbreak.
Yes.
And then 10 years later, the virus was essentially deemed eradicated in the US, but now it's back. Why do you think that is? Is it because vaccine rates are low again?
It is. They're low again for a number of reasons. One, of course, is the pandemic and the loss of access to care for periods of time. Some people have lost that on their to-do list, and other people are now in that movable middle that are asking questions about vaccine safety.
And what's your messaging to people who may be concerned about vaccine safety? You touched a little bit about your strategy for addressing this problem in our area schools, but how do you encourage people who may be unvaccinated for a variety of reasons? How do you rectify that problem?
This vaccine that we use to protect people against measles has been out for many decades. It's been proven to be safe. We have a number of safety reporting networks across our country that have been monitoring its safety for decades now, and it's been proven to be safe.
And now let's talk a bit about misinformation regarding measles treatment and vaccines in general. We know there's a lot of it out there. Health and Human Services Secretary Robert F. Kennedy Jr. has recently said vitamin A, cod liver oil, and select steroids and antibiotics can be used as measles treatment. Is that correct? And maybe what are some other myths that people may have about the measles or vaccines in general that you'd like to clear up now?
So measles does not have a definitive medication that can be used to treat it. We do know that there's some treatment that's offered to people who are hospitalized with measles, which means they have a serious complication or have developed a serious condition that's related to their having measles. They're receiving vitamin A under the supervision of a physician. And that is where vitamin A has its place. Other than that, we do not have treatment that's available for measles, and care is supportive. And it's for that reason that it's so important for the public to understand that if you get vaccinated, you protect yourself from having that serious complication, hospitalization, or death.
And hopefully we can get back to a point again where the measles is once again deemed eradicated in the U.S.
Yes.
Well, Dr. Walkes, thank you so much for your clarification and this good information, and thanks for being with us today.
Thank you.